So good evening. My name is Becky Arps, and I'm the chair of the St. Louis chapter of the Society for Information Management. On behalf of the SIM St. Louis chapter, I'd like to welcome you to our 15th Annual CIO Forum. Before we get started, I want to encourage all of our members and anyone interested in becoming a member to renew their memberships to continue to gain access to amazing programs such as this. If you have any questions, please check in with our amazing membership chair, Karen Tappy. I hear rumor that there might be some discounts available for renewal this year if you do it before the end of the year. We will be setting up our schedule for next year within the next week. So please let Saeed and Elizabeth, our program committee, or any board member know if there are particular programs you'd like to see for next year. For those that are interested in leadership development of themselves or high performers in our organization, the Regional Leadership Forum and Executive Regional Leadership Forum are amazing. So please let us know if you have questions about them. In the last 9 months, we've survived a global pandemic that has turned our world upside down. We've had our normal changed in ways that we never imagined. We've had a chance to catch our breath a bit. Tonight, we have some amazing leaders that will talk about how they and their companies have survived, how their normal has changed, and how they plan to move forward. It is my pleasure to introduce to you our facilitator for tonight. He is a former SIM St. Louis president, head of the Global IT Project Management Office at RGA, and most importantly, the coach of his son's basketball and baseball team, Jeff Vilmer. Jeff, it's all yours.
Okay, thank you, Becky. I appreciate it. Memberships to SIM, make sure you take advantage of that, especially if you can get a discount. Sounds like Karen's offering some great packages if you sign up between now and the end of the year. This is the 15th Annual SIM CIO Forum. I didn't realize that. I knew it had been going on a long time, but I didn't realize we had 15 years of that. So I'm privileged to be your host tonight, if you will, and we've got some great panelists. So I want to start off really, first of all, by saying that the pandemic is a very serious event. There is devastation to some families. I have family friends who are going through the virus right now. I know people who've had deaths in the family. So I want to just make sure we emphasize that we are all extremely sensitive to the seriousness of the health crisis. And the reason I say that is because, one, I want you to know that we're sensitive to it. And number two, we're going to talk about it as if it's it's a crisis that's going on out there. But I don't want to diminish the fact that many of you and your families may have been impacted by it. So I shared this in our prep sessions with our panelists, and they are 100% supportive of that. So from my perspective, just a little introduction. I've been a SIM member at different times throughout my career. I had the opportunity to be a SIM president, and I've always valued the kind of thought leadership that SIM brings to the table. I'm going to ask a question for later, maybe we can cover. I don't know what the plans are this year for Gateway to Innovation, but if any of you have been involved with that or that event, that's one of the marquee events in the St. Louis area, and I would encourage you, whether it's virtual or in person this year, make sure you attend that. And then the last thing I wanted to kind of mention about SIM is this is a professional organization that does an outstanding job of giving back to the community. So I don't have the numbers handy, but I know that the dollars and the impact of the charitable work that SIM has done is really quite significant. So I'm pretty sure Eric or maybe Karen or one of those guys can give us some specific numbers maybe toward the end of the session. But I wanted you to be aware that that's a very, very important aspect to SIM's operation. So with all that kind of initial context being set, usually at the beginning of a session like this, the facilitator spends a great deal of time introducing the panelists. I'm going to shift that responsibility a little bit for two reasons. One, they know themselves better than I do, and I don't want to drone on about them. They're going to pick out some interesting tidbits from their perspective that they want you to know. And then the other part is, as a participant or an attendee to these sorts of events, I always wonder, where is the panelist coming from? Are they talking about an organization that has 100 people or 1,000 people or 100,000 people? Are they, waving their hand and making things happen, or are they having to do organizational change management through the entire hierarchy of the organization? So I'm going to go with John first from Panera, and I'm going to ask John to just kind of set a little context for where he's coming from. We'll have all three panelists do that, and then we'll get into some more meat of the topic.
Thank you, Jeff. I'm John Meister. I'm the CIO of Panera. I've been at Panera for about 7 years. There's a couple of former cohorts in the audience. They're texting me lots of questions and commentary, so love that. I have, this time a year ago, Panera IT was a little over 500 people, maybe even approaching 550. That's all in, professional services, contractors, employees. We reduced through all of this crisis to 320, 330. We've come back up to about 400 now. The restaurant business has been pretty hard hit by this. We describe the comeback as a check mark, I think is probably the best way to look at it. So it was a very deep dive in the beginning, and now it's a long recovery period and very slow. At the same time, we'll have to come up with something new to describe it, because with the new resurgence and lockdowns, we're definitely taking a step back and retreating a bit. It's very geographic based as well, and we monitor the COVID numbers in all the states. And from a survivorship standpoint, I'll get into a little bit about how we started our thinking in one way and have transitioned to another.
Okay. John, how many stores do you guys have across the nation? And you said roughly about 400 IT people now, but how many people are you supporting? How many devices do you have out? Anything like that?
Good questions. We started out with about 2,300 stores before this. We're down to about 2,200 now. We have lost stores, lost cafes. In terms of devices, it's about 100,000 employees, probably 20,000 devices in the field. That's all the way from sensors and smart ovens to actual point of sale machines, back of house machines, network equipment, all of those things.
Okay. All right. Thanks. Anything else from a demographics sort of standpoint you think you could offer that would be helpful for people's context?
I do think we're Panera punches above its weight from an IT size standpoint. We started out getting into what we call Panera 2.0, which was mobile ordering, order ahead, catering, delivery, before most other restaurants did that. You had pizza players out there doing mobile ordering, but it was substituting for phone in, and it was delivery. And we created this rapid pickup and then kiosks as well, and the first wide scale implementation of that. So I think we really did a digital transformation of quality for a company that's much higher in size than we are. I guess the best way to describe that.
Okay. Well, you pick Scott or Jerry to go next.
Oh, let's go with Scott because he's got the nice blue jacket on.
Okay.
I thought I'd pull one out for tonight. I actually had a little dust on the shoulders. I had to wipe off. I heard a joke that someone said out to steal it, but they said my dress shoes think that I died.
Right. All right. Well, same question to you, Scott.
On Twitter.
Same question to you. Kind of do what you can, I think, to kind of set the context for your organization and the kind of your purview, if you will.
Yeah, very good. Thanks for having me tonight. Yeah, I'm Scott Richard. I'm a St. Louis native. I've been at Mercy forever. When I say how long it's been, I feel pretty old, but I've been there 30 years now, and I've been in many different roles in the IT organization. Been the CIO for a little over the last year or so. So Mercy Technology Services is the name of the shared services division at Mercy that provides IT services. And we're about 1,300 or so total, and that includes 400 people that are kind of more definitely related to the electronic medical record business analysts, so people that are kind of quasi clinicians and also technology people as well. And we had, in the late spring, we did have a downsizing as well, like the rest of Mercy, and we reduced our staff by about 100 or so. But so just in general, Mercy's a Catholic healthcare organization. We've got about 45,000 coworkers total. We support 44 hospitals, and if you think our locations, we're headquartered in St. Louis, but if you think of Interstate 44 as a backbone, we've got Mercy Vertebrae all the way down to Oklahoma City off that backbone. So most of our locations are within a 45-minute drive or so of Highway 44. It's kind of the way they're laid out. But we are from an IT perspective, we're, like I said, we're part of the shared services organization. We're pretty standardized for a healthcare network like ourselves. We consolidated the IT organization over a decade ago, and we're pretty standard in terms of our software portfolio and our desktop, and we have 2 data centers. That's it. So we're pretty agile from that perspective. Mercy itself has, over the last few years, has really become a little bit more of a central command and control organization where we have more centralized leadership structure. It's been pretty effective, and I think the COVID situation is definitely something that we'll reference through all of our careers. I know, to me, reminds me of Mercy. We had a tornado in Joplin in 2011 that destroyed one of our hospitals, and I still talk about that regularly, and I still reference that as an event. So I think we'll all see that in our careers as well. This is a watershed event, but so we're in the mode now. We'll talk about some more, but we're in the mode now where we're trying to both keep our longer term digital strategies going and on the front burner. At the same time, reacting to the daily news about the COVID, the COVID levels, and obviously we have a lot of very important caregivers that are very stressed and very overworked right now, and so we're really focused on trying to make sure we're doing everything we can to enable them, and we definitely have a passion to do that, and all the way from early days of the breakout and testing through the vaccination administration, we're trying to do everything we can to really understand those caregivers that are putting themselves at risk and trying to do everything we can to make that better. So it's an interesting place to be right now, but very, very rewarding.
Okay, thank you, Scott. How about you, Jerry? You're next.
Thanks. I appreciate that. So Jerry Lewis, I am with Ascension. I run Ascension Technologies. I've been the CIO here for about 5 years and have been with the organization about 18 years. Ascension also is a healthcare provider, also a Catholic health system. We have roughly 2,600 sites in 19 states and the District of Columbia, 145 hospitals, 40 senior care facilities. We have 9,000 employed docs, 40,000 aligned providers, and 160,000 associates across the country. So much like what Scott said, I mean, we have been really focused on accelerating our digital strategy through this, because the sea change, and I've mentioned this, for us is, consumers and experiences. And right now, the healthcare consumer's preference is for home and is for contactless care options. And so we've been working diligently to provide that, which we'll go into much more detail later. But again, we've got 3 digital studios we set up last year, one in St. Louis at Cortex, one in Austin, and one in Chicago. And we're really focused on 4 things from an IT perspective or technology perspective. One is creating a differentiated experience for our consumers and caregivers. Number 2 is modernizing our platforms. Number 3 is leveraging data as an asset, especially through the pandemic. We've really focused on leveraging information for beds, for incremental beds that are needed, and for medical devices that are needed, and how do we forecast those more effectively? And I think then lastly is just redesigning our service delivery model. How can we significantly improve technology services to our end users?
All right. Thank you, guys. I appreciate that. I think that'll really help with the context. So we have an interesting topic here that is really popular in this webinar sort of space right now. Lots of panels that you'll see. So what we're going to try to do tonight is give you two flavors of this, really maybe three. The first flavor is going to be what kind of things, what challenges did we overcome from when we found out about the pandemic and started to address it to where we are today. So let's think about that chunk of time and those challenges and decisions we had to face. And then we're going to talk about things like, well, of those changes we've made to our organization, where do we go from here? How much of those, what are those are going to persist? Where do we still have gaps? What do we have to do to close those gaps? What does the new workforce look like? And then Jerry, it might have been you the other day that mentioned it when we were talking, but now there are new friction points. So part three, and it may end up being woven into the other two, but a significant part of what we want to talk about is also this new friction points. What are we managing now that we weren't before? What are we paying attention to now that we weren't before? So that being the context now, I'm going to offer it up. I see that Scott is on, his microphone's active, so I'm going to go to him first. And I'm going to say, Scott, if you don't mind, take us kind of through from, maybe day zero, if I would be, use that phrase, kind of day zero to where we are today. What have you guys at Mercy done?
All right, thanks, Jeff, for picking on me first. And if I go off track, just rein me back in. But it's a long story, but I'll try to keep to the highlights. So to me, I think about it in kind of the phases. So I remember back in early February, before, when we're starting to hear the news and we're starting to see things that might be coming, and I think we're all having a hard time believing this is really going to be that bad. But I remember the things we did to kind of, one of the analogies I always use, you see where the hockey puck's probably going to, and you start skating there. So I remember reaching out to our HR leadership and saying, hey, what would be our position around work from home if we had to send many people to work from home? Obviously, with healthcare, there's a lot of people you can't, but there's a shared services organization that's very large. And so we started thinking about our work from home contingencies. And in February as well, Mercy has a telehealth practice that's been established for many years, but it was kind of a limited scale. So we started thinking about what if we had to do a whole lot more telemedicine visits or video visits than we do now. And so I will say that, members of my team kind of came forward with, we had a what if meeting in February, and what would that look like? How would we be ready for more work from home? How would we be ready for more telemedicine visits? And so started talking to our video cloud vendor and say, how many concurrent sessions could we have potentially? So we kind of started poking the edges of the what ifs, and I was really proud of our team at that point because they're a very, very proactive team, and they came up with some really good ideas. And I was impressed with that. And we, I think Mark Brazil's on the call, and that our infrastructure team started looking at our supply chain channel and how many laptops do we have. And so by mid-March, when we knew we had a big problem, that's when, Mercy, and I'm sure you'll hear the same from others, that's when our organization feels like it really changed for the permanently. We established kind of daily stand-up, we call them command center meetings, where, the senior leadership of the organization started coming together. And, what was really different about that is that structure, just a simple thing of getting everyone together every day. We started looking at the same metrics and objectives. So we were talking about beds and ventilators, and do we have enough, and can we move things around, and what if it surges this much versus that much, and how do we, what's our plan B and plan C? And so, what I observed is, the organization started looking at and talking about the same metrics. And so, we really zeroed in on about a dozen or so metrics that were the most important. And then of course the demand was, well, we need to get these metrics, fresh every day, and we need to have dashboards. And so, our data analytics team has really been the star of the show from an IT perspective. All of our teams have done great things, but that team has really been great at helping the organization have the right data to move on. And so we all focused on that. So we also started adjusting for the structural impacts of the pandemic. So for us, how do we create surge capacity, testing sites? Do we bring patients to the doctor's office, or do we want to route them somewhere else? And then, one of the immediate challenges once that testing started coming out is we ended up with a 4-hour wait time on our nurse on call center. So we had some major problems that we could not provide the services that we wanted to our community because our structure was not set up for that. So we did some, as Jerry mentioned, we did some digital transformation that moved really quick, and we looked at what we had, kind of a MacGyver situation where we said, well, we've got this telemedicine organization, Mercy Virtual. We have the good call center set up. We can do virtual call centers, so we can broaden the number of call center agents. And then we actually use some tools like ServiceNow to create an intake process for how do we bring in these patients. And then we also created a text-based, SMS-based at-home monitoring situation that we actually are still using now, and using that to decant patients out of our inpatient scenario. So a lot of what we are doing now, we will be doing around remote care, was really juiced by that, by that early days. And we were able to, within a couple, 3 weeks, to get a digital channel set up, and we were able to get that call center volume, way down, set up an IVR to help get more people through it. So that was the one, the one area of just preparing for that massive inflow of patients, and there's uncertainty about how many we would have and how much worse this would get. Obviously, none of us knew that. At the same time, the IT team is also facilitating this shift of about 5,000 people from, work at the office to work from home. And like I said, the team did a great job at looking at what assets we had, figuring out how many laptops can we get our hands on, and what's our remote worker situation look like. We'd already had about 1,500 to 2,000 people that work from home already, call center agents and revenue management people. So we had some things that we knew that worked, and we were in a good position where we had infrastructure that would scale. And, so I was really proud of our team for being ready for that work from home scenario, and a lot of logistical things we had to figure out. We created some team sites and SharePoints, but our team was very early. In early days, we created from the IT perspective, in February, we created a list of, let's get all of our coworkers in here and start tagging people that could do their jobs from home versus had to stay in the office. And then let's track that, and we'll have our plan ready to go. So that ended up being kind of a model for how the rest of the organization used it as well. So that, that dual path of really enabling the organization with that daily command center stand-up huddle. What do you need? How can I get it to you? And the benefit you had, you have all the hospital leadership there. You have all the clinic leadership. If we decide, let's do this, any objections? No, let's go. Whereas before this, it would have been a scenario. We have something new we want to do. Let's pilot it in one of the hospitals, see if it works there, and then move it on to the next ones, and then try to build a consensus. And this moves much faster. So that's changed the way we make decisions. Now we're dealing with another surge, but we also have used that command center to really set. We have 2 or 3 focus areas all the time where we're really focusing on. Okay, this is the part of our inpatient that was for the high friction, and it's really putting a labor load on our nurses. How do we impact that? So, like the example of using some of our virtual care services to decant patients from the hospital that just need oxygen and monitoring, but don't necessarily need an inpatient room. So we're able to send hundreds of patients home that way. So it's become an idea machine and an iteration where we're moving and iterating a little more agilely than we ever have before. And we're not used to that as an organization, and I think that's going to be our new fingerprint. So So I'll pause there, but that's to me, that's the heart of what's different about Mercy since February and March.
Okay. I'm gonna come back to you on a couple of the most difficult things you had to implement, and what kind of maybe your one or two largest challenges that you faced, because I can imagine trying to put 100 people on a daily stand-up and have that be productive. To me, I'm going, well, how did you do that? Who ran it? Who initiated it? So percolate on that for a minute, and I'm gonna head over to Jerry, and I'm gonna ask Jerry. Scott just spent 8 to 9 minutes on that. I'll throw my timer on and you do the same thing and we'll go from there. How about that? Where'd you go from the beginning to kind of where you are today, and what challenges did you face and how'd you overcome them?
Yeah, so I'll break it down really into 3 areas. The digital strategy acceleration, infrastructure and security, and then collaboration and agile, because I think those are all significant changes that we've made. Our digital strategy has been significantly accelerated, and we also include the holistic end-to-end viewpoints in terms of human-centered design thinking. The real challenge for us was, how do we actually start to operate virtual visits at scale? Going back to, people want to be safe, much more, they want safety and convenience. So how do we do that when we had a couple hundred virtual visits a day? When the first spike, we had over 17,000 virtual visits per day. So the ability to do that effectively, I think, was extremely important. And, our partners had to, they essentially had to rebuild their architecture 5 different times, because we were going at multiples of thousands of percentages during the week. So that's one thing. And I think the other thing that the teams did that was really important on the design and research part, we accelerated meeting patients and providers and asking how we can make the experience better. For example, we saw during the pandemic the need to redesign the emergency room because there's a real fear of contracting the coronavirus. So after gathering feedback, we did a few things. One is we built an application for virtual ER consultations. Secondly, we extended our online registration in place of inpatient.
I got to interrupt you there. I mean, you said we built an application for ER. Is that something that you already had in flight, or did you guys just ideal that one and then
we
build
built many applications? Yeah, and so we've got, one of the things that we've been investing in is software engineering, obviously, just so, again, to provide a differentiated experience. And the other thing, when tracking patients, Scott mentioned remote patient monitoring, a significant opportunity for us collectively, so that we could track patients after sending them home, so we could manage we created a COVID specific application that allowed us to do that more effectively from a remote patient monitoring perspective. Our teams also launched associate screening tools, so that, when they come into work, we can track, along the CDC guidelines for each associate that comes in. So we created an application for that. We created a mechanism to auto-notify patients of their status regarding surgeries, and again, trying to really communicate more effectively and leverage the digital channel to do that. So that's one significant challenge. I mean, we were on a very different trajectory before COVID, and went vertical in several areas in terms of the amount of work that the digital studios have been doing to supply both consumer front-end solutions as well as continuum solutions to our caregivers. The second area that really is for us, and you ask about, will that change? No, I don't think. I think there are a lot of opportunities in healthcare to improve the experience, and we're seeing that now, and I think we'll just continue to accelerate that. And we'll accelerate the transitions and make those transitions a lot more effective and easier for both consumers as well as for caregivers. The second part is really on the infrastructure and security side. Again, we moved, in a week, we moved over 20,000 associates from office to home. Significant amount of work in terms of, will our circuits manage that? Our external circuits manage that? Do we have all the VPN licenses? And can we manage that effectively? And so our team was able to leverage the investments we made on the infrastructure side so that we could effectively and securely support those 20,000+ folks going from office to home. You know, our security teams, and much like other security teams, I mean, you know, the new thing was, oh, well, how do we manage, COVID malware? So, you know, 3 days into it, we had, you know, identified 65,000 suspicious new internet domains, and we still address over 7,000 suspicious COVID-related emails per hour. So again, we amped up our cybersecurity responsiveness and management. Then I think the last thing from my perspective is changing how we collaborate, because there's no one in the office. And how do we collaborate effectively with our caregivers? And so, you know, clearly a lot of work has been done to think about, like Scott mentioned, the daily stand-ups, which we also do. And we also we've moved our entire team leadership meetings to a weekly basis. So everyone, we're being as transparent as possible. People are really interested to understand what's going on with the COVID, what's going on with spikes, how are we managing the communications. And we had, you know, our physicians on so that they could give feedback on a weekly basis to our larger teams, so that they can understand what's happening. We do daily stand-ups from a leadership perspective, and just so that we can manage, you know, issues that come up. You know, again, when COVID was, you know, was the first spike, and now this spike, how are we managing needs that our clinics and hospitals need, and so we want to be very proactive with that, and that will continue, I believe. And the other part of it too, I mean, we felt like a 400-year-old startup in terms of the agile work that we're doing in constantly iterating. And a lot of the work that our design studios and our software engineers did was just constantly iterating. And for healthcare, that's new. And for us, I don't see that going away either. Again, to continue to improve the experience, to continue to leverage data so that we're being much more active and accurate into predictions, so that we can effectively manage operations at the scale that we needed to. We also worked with providers to create over 700 secure network in a box. So as we were getting to, in areas where we were getting to maximum limits, we could create alternative sites very easily and effectively by extending our network with these devices. And so there were several areas in the Northwest that we had to set up alternative sites so that we could care for patients in various spots, and we were able to easily extend our network and do that with the great work that our teams did.
Thank you. Jerry, anything else there? Because I'm going to come back to you on a few things.
Sure.
I think we all want to hear more about, one of the interesting questions is, how did you spin up that app app development work so quickly and be so productive? Then the kind of corollary to that to me is, well, what didn't get done? So you had a roadmap, I'm sure, that was already set out. And when you shifted those resources to handle the pandemic, what stuff's on your back burner that maybe you're going, oh man, we still got to give that attention? So we'll come back to that one. And then I think we also want to hear more about, you talked about your partners having to kind of re-architect the network or the infrastructure 4 or 5 times. I think I want to unpack that a little bit when we get a little further down the road.
Our virtual care partners, they did, absolutely.
Yeah.
When you're going at 1,000% per day, that's a challenge.
Yeah, and I think we want to hear about, you know, how they did that and what kind of management style you applied to it and what that looked like. So those are a couple things we'll come back to, and I'm seeing some other comments in the other places. So, but let's shift over to John, and John, you go ahead and take 8 to 10 minutes and give us the from there to here sort of narrative.
Sure, Jeff. So our experience is a little bit different. We had some things that were easier, but some things that were harder in the healthcare space. So for us, it really became survival. We weren't sure if we were going to survive, but we experienced a 90% drop in business overnight. That wasn't as bad as some of the other businesses we were talking to, though. We talked to one travel provider that had 120% revenue drop the following month because they were issuing refunds. So we were thankful we were where we were. But in the first 2 weeks, we really tried to figure out, it quickly became not we weren't deciding what we weren't going to do. It was nothing is going to happen. What must still happen, right? Let's assume we survive what has to continue. And going through and restructuring an entire workforce around that. And then furloughing as many people as we can. And we did a daily stand-up twice a day with the CEO and his direct reports. There's 10 of us. We've been a company in transition anyway, from a leadership standpoint. So for perspective, the CEO's direct reports, I have only physically met 2 of the 8 of us. So there's 7 that I have not physically met in the same room with. They've all started since this COVID outbreak.
Wow.
So quite a transformation. I would say by mid-April, we were figuring out how to survive. And we were by this time, we'd come back to about 50% of our business. And the daily stand-ups at all levels, we're breaking down silos immediately, right? It soon became, you enrolled people in, we need to do this to survive. We need to do this to survive. And then we called it fighting for the family. We need to do this to not only survive, but bring back enough revenue to keep all of the employees that we had furloughed, basically. And it became a very personal thing for all of us to actually get this work accomplished to save as many jobs as we could and save as many restaurant locations as we could. And so we did things like on a Friday night, the CEO called me and said, in the city of Boston, no one can get groceries delivered for 2 weeks. All the delivery drivers are out and there's food insecurity all over the place. And our customers are letting us know, right? We're hearing about it in customer feedback in all sorts of places. So we actually, by the following Monday, so 10 calendar days, we started selling groceries through all of our digital channels and delivering those. At the time, we thought we have lots of food in the pantry that's going to expire if we don't sell it. At the same time, we have to repackage it as a grocer would, make sure the supply chain could handle and withstand this. But we created a new line of business in 10 calendar days. The following Friday, I guess it was the Friday before the grocery launch, we did the same thing with the curbside. So how do we allow customers to still do a rapid pickup, but no one can come in the cafe? Because all of our locations were basically doors closed, no one allowed in. And so we did a curbside type of capability where we already had all the digital pieces in place. It just simply became the customer hitting a button on the app or the website as soon as they pulled into the parking lot saying, I'm here, and we brought it out. We then implemented that in 10 calendar days again. That became our cycle. In calendar days, speaking calendar days, because we stopped considering work days versus non-working days. Everything was a work day. We also started to enhance that with geofencing and all those types of capabilities. We very quickly found technology we wanted to integrate and integrated it very quickly and got it out. So for us, though, the key to this was we'd already done a digital transformation. We were already used to working in an agile manner with the business teams as well. And we were breaking down silos across the board very, very quickly. When the entire executive team is talking about the status of every effort twice a day, the silos go away immediately. And that really continued. Once we got to the summer, that's when we started to relax that a little bit. We're still doing daily stand-ups 2 to 3 times a week at the executive level. The silos are completely gone. We are talking about things in the morning and have an implementation plan that's been vetted across all teams by afternoon. So we are as collaborative as anything I've ever experienced. And I don't think that goes away. I think the challenge, right, is how do you continue to keep people engaged? It became very quickly that everyone was on this treadmill and running as fast as they could. And after so many months, it got to the point of, oh my God, right, we're all gonna drop dead at some point from the work pace. And we did a few things where we gave everyone 4th of July weekend extended weekend and a couple of extra days, we started doing mandatory Friday afternoons off for a lot of people starting in the summer. There were exceptions to that, but we tried to hold those very tight. And we really came to try and keep people refreshed, a little bit more balanced. We've since come back to a 5-day work week, but we still find ourselves having teams, multiple teams working in sprints very, very hard when we have this new emergency to get sales out or to get flatbread pizzas out, those type of things. Coffee subscriptions, another innovation that came through all of this. So we've really, you think about restaurant transformation, it used to take us 18 months, was the fastest time frame where we'd turn around a new menu item. We figured out a new line of selling groceries in 10 calendar days. So it's a complete transformation. Some of the other ones that we still find challenging though is how do you keep everyone engaged, right? You can't have all employee meetings. You can't do rah-rah team lunches, any of those type of things. And video is great, but you have to up the frequency of those touch bases with all the employees and keep everyone engaged. And so we've upped the recognition as well for employees and teams as a whole, doing frequent awards, whether it's the CEO giving an award, a CFO, or the supply chain giving an award, all of those type of executives giving out an award to a team other than their own is really up to the recognition. And that's helped tremendously as well.
Okay. We're gonna probably on some of those, John, we'll come back on how did you leverage the agile practices or framework that you already had in place, and what were you mentioned it, it's one thing I want to come back to too, is that human factor of speed, and that can only last so long. So when we talk about this model persisting, I'm interested to know what proactively you guys are thinking about, and and who is it? Who sources that idea, that the recognition ideas? Is that HR coming to the table, or those other employees? Those are kinds of things I want to talk about when we get to the next level. So Scott, I'm going to come back over to you. I mentioned before, let's talk through maybe a couple of the specific challenges that you had. A place where it's good at this point, we can say, hey, from there to here, here's the success stories. But how about one or two things that you really ran into a brick wall and then either didn't resolve it and abandon it, or that you did overcome, and what was the process of overcoming?
Yeah, thanks, Jeff. I was thinking about what John said about that fighting for the family. I think I'm gonna steal it. That's a good way to put it. Really the first thing I did think about as a challenge was a people thing, because the teams, the IT teams that were needed during this thing were really needed, and they were needed every day. And, the data teams are constantly being asked to, do more analysis and clarify some data points or get more things on the dashboard. So we really had to watch our people. We have a lot of people that didn't want to let their organization down, and they know they're supporting nurses and physicians that were very tired and were very exposed to risks. And so our team really just never wanted to quit working, basically. And so that's something that had to be managed, because as John was saying, that's not sustainable over the long term. And the other thing is that everything that came to our inbox kind of had a COVID stamp on it. So we need this for the COVID response. And was it really part of the COVID response, or are we just labeling it that way? And so again, having that command center structure every day started to be our response. Is this command center priority? Is it in on one of the focus areas? And if it's not, we're going to have to put it to the side. So I think watching the team's well-being in general, I think was a challenge for me and for all the leaders in IT. And and as we talked about, it's also a situation where people are more remote and not together every day, and so it's harder to keep the culture tight and keep everybody feeling like they're being cared for by their organization, because people are spending a lot of hours. The second thing kind of relates to what Jerry mentioned, and I always think of, I'm so impressed with Panera. I want our consumer experience to be like Panera's when we grow up. That's awesome. That's where we want to be. But I think, a challenge was kind of getting over into that mode that Jerry described of having to iterate fast. And we were doing that in some areas, but we really had some areas we had to get okay with minimally viable product releases. Okay, the first thing is, here's our main problem. People are waiting 5 hours in the contact center. We can't make the perfect digital experience. Let's just get something quick and dirty for release number 1 and get it out there. And we've got all these physicians who now their practice offices are closed, and so they have time. Let's get them on the calls, get them on the phones. And so it was we had to build. It wasn't just technology solutions. So if, like, for the COVID screening, we had to have, our virtual care operations had to adjust, and we had to have contact center adjust, and we had to have physician practices schedule a little differently. So, we created not only a digital product, but we created here's the whole flow of how a digital care model will happen. Not just an app, but here's what this part of operations has to do, and here's the people you need, and here's how we have to change things. So, creating those fusion teams was was hard at first, but we really got to the point where we started to get good at it. And as Jerry said, I think that's going to be the way we operate going forward. The third thing I remember being tough is that we still had all these other priorities that had to get done. So we have our longer term strategies that are still very much important, and they're critical for the long term survival of Mercy. And so those projects needed to keep moving. We have a major tech debt project right now where we're consolidating our 3 electronic medical record applications into one. That's a huge, hundreds of thousands of hours project that is happening at the same time as all this. So we get into the prioritization mode of what's most important, and it's all most important. And so, all of our kind of our intake and our prioritization process that we had before kind of got thrown out, and we had to kind of re-envision, and we still don't have it perfected. We're still trying to deal with that and deal with multiple priorities. But I think that's a third area that was challenging for us in the IT leadership perspective, and really puts our team at risk of being overwhelmed with requests that they don't know how to prioritize. And I think that's falling back on us as IT leaders to really help them resolve that. And that's still not done, and we're still dealing with that.
Okay. Thanks, Scott. Jerry, there's a number of questions in the chat and other places about this development of these apps so fast. Maybe you could unpack that a little bit for us.
Yeah, I'm happy to. I mean, we made, I would say we invested in the digital studios 18 months ago. So again, this is not, we set these teams up, and 2 days later we're providing applications. So we were very intentional about how we set these digital studios up. And we focused on a couple of different things. One is that the end-to-end design thinking. So are we solving the right problems? Do we have the right people that from a research and an ethnographic perspective that can ensure that we're looking at this end-to-end? Because I think we haven't done as good a job as looking at how we solve the end-to-end problem versus just point problems across the continuum. So that's one area. We've been really thoughtful in terms of bringing in, again, changing the culture from one that's very focused on COTS products to leveraging our own solutions to provide a differentiated experience. And so that was, we created a software engineering organization again, almost 2 years ago. We significantly ramped up our data management with our new chief data officer. We hired a new chief data sciences officer, so we had all the pieces in place. And so again, as we were working on, we had a digital strategy, and the acceleration of the needs for, at home and contactless opportunities, it just was, allowed us to leverage those capabilities that we had already invested in. And so we were very thoughtful about that strategically. And again, we know that, how do we start connecting the front door and creating the relationships that like, I'm a Panera customer. I have they know exactly who I am, and they know exactly what I like to get when I go there. We have to get much more intentional about how consumers of healthcare want to be engaged, what the experience that they want to, what's the experience that we need to create for them. And so all those really played into our overall strategy. So this was something that we had been prioritizing over the last 2 years in terms of those capabilities to be put in place. And once, again, as we got impacted by the COVID pandemic, and we saw really quickly, again, healthcare worker concerns and just the stress on them, patients and their families, and the stress and challenges from a communications perspective, we were able to provide, again, iterative solutions to allow us to communicate more effectively, to create the experiences, to address some of the challenges that were brand new in a lot of these cases. Because like most facilities, we stopped patient visits for a period of time. So how do we amp up then the communications? And most of that was digital communications. And so we tried to, again, all those efforts, we had a lot of MVPs. Again, we were a 400-year-old startup, iterating constantly, continuing to provide more value and adjust to the problems as they were being presented to us. And so we had those capabilities that we had invested in, and we were able to leverage them to meet some of these needs. Now, there's clearly a lot more work that we need to do in terms of continuing to improve the experience and continuing to improve the engagement and integration across the entire care continuum. And again, those will only continue to accelerate as we move forward.
Yeah. Did you see a shift I understand that you had these digital studios already in your roadmap. So you had them built, you had them operating. Did you see a shift in investment that made them, more people, more resource, or was it just more attention? What was the dynamic that worked there to create the value that you guys produced?
I think a few things. I think, again, virtual care there's a lot of regulations around virtual care, both how it was managed and how you could practice it and how you got paid for it. A lot of those kind of were put in abeyance. So we had new opportunities that all of healthcare had to take advantage of. And I think providers wanted to take care of patients, and they wanted to leverage technologies to do that in a way that was safe for both the provider and the patient. And so we provided that pathway. And so I would say it's both. We had significant amount of brand new issues and friction points, to my earlier point, to address. And we leveraged a lot of that with the digital tool set and the suite of products that we had and or created during this time frame.
Okay. I'm interested to know if there was, and this is a question for all you guys, this one's about, was there more of an appetite for defects? Were you able to do things where people gave you a little bit more forgiveness when something didn't quite work? Because this thing, we have extremely rigorous processes in all of our IT shops about how you get something through the cycle and into production. Even if we do it in the best of agile circumstances, there's still a lot of gates that you have to go through. So I'm interested to know in that regard, kind of how that played out.
I think given the need and the criticality, if I could deliver 30% of a solution to a problem and continue to iterate that over the next 3 months, is that acceptable? I mean, at that point in time, absolutely. People were looking for how do we provide solutions, again, in some instances, incomplete solutions, but there was much more focus on let's continue to improve because, again, situations were changing. And we had to do something to at least broach the problem and then continue to iterate on it as we collectively got smarter.
Okay.
as both providers as well as consumers and their expectations, and we needed to continue to manage that. So,
How about you, John, on that one? You guys were already doing some, agile in place. What did that look like? What characteristics changed?
So I'll talk about what changed and what stayed the same. So when we went into this, our business was about 39% digital. Became 100% digital, right? So there was no tolerance for outages. But there was tolerance for not getting all the customer friction out. So for example, on groceries, we launched with half of the products that we thought we would need. On curbside, we made the customer push a button. Later, we made it so that we could detect them coming on site automatically, right? So we eliminated friction as we went, but careful not to disrupt the stability.
Okay, guys, I'm going to do something here. It's about 6:30, so we got about 30 minutes left. So I'm going to go to the questions, and I'm not going to ask all of you to answer each question. I'm going to pull up a question or mention what somebody typed in, and you guys, do the Jeopardy button and see which one of you gets in first on it. And then we'll do that until we can exhaust some of these questions. And then the last space we'll go is into those new friction points. What do you think is going to stay the same? What's going to be different? What are the new things you have to think about? So I'm just going to read these out, and hopefully we'll decompose as we need to. How are each of the panelists leading to support innovation during the pandemic? So we've heard a lot about innovation, delivering better patient, customer, coworker experience. You guys, is there anything you want to add to how you're supporting that innovation in your companies?
No, I'll jump in. I think that's an interesting question because I've been thinking about that too. What does innovation look like today versus what it was? And in my mind, it's definitely more focused. So I think our organization has the attitude of let's focus on the things that are most important and lay down the things that aren't. So I feel like we're a little narrower in innovation. I think it's probably just a period we're in right now. But I think the things around reducing those friction points, we're all in on that, and bring in the new ideas. Just the general, let's talk to every new shiny vendor that's out there and see what they have to offer. That stuff gets put on hold a little bit right now. So it's I would say it's focused innovation, a little less broad based than it was before.
Okay. How about this one? I'm curious about organizations that have shifted into remote work. What type of support are your employees getting in respect to the resources they now have to supply, such as internet or electricity, phones, mobile devices, any stipends, anything like that you guys are offering to employees? Maybe a real quick round robin on that one, just to get all three of you.
yeah, I mean, we're starting to offer stipends on that, as well as obviously office equipment, and
Okay.
to allow that, to ensure that they can do their job. And I still think there's a lot of challenges with that, obviously, in terms of just making sure you've got the right environment. And I think it's a challenge for families to balance work and family time. And I mean, there's so we try to be thoughtful about how we schedule meetings, and there's lots of meetings that you hear the dog, you hear crying kids, and you have to figure out how you manage that. And it's our HR and teams are trying to help us work balance more effectively, because it gets really challenging, to be honest with you. If I can get up and walk 5 feet to a desk and work all day and then walk 5 feet back to my bed, that's probably not a good, well-balanced associate. So we want to be thoughtful. And I've been saying that, listen, this is a marathon. I don't know if it's going to go 50 miles or 128 miles, but you've got to be able to create that balance for yourself. And for some, that's hard. And so being able to be thoughtful about how you manage work life is it's top of mind for us. And getting better at that and helping our associates get better at that too is really important as we continue to move forward, because, everyone's not going to be back in the office. I mean, clearly we've not left our clinical areas or anything like that. But I mean, I think office-wise, I think it'll be more the norm in terms of the remote work that we have.
Okay. Scott, John, you want to comment on that?
Yeah, so Scott, I'll say so. At this point, we don't have a stipend program, although I don't think anything's off the table. We do have to acknowledge the new realities, and obviously we provide all the technology equipment. But you know, having this be the long-term scenario, I think, is driving iterative HR policy conversations, and I think those will continue to evolve. So at this point, we don't. But like I said, nothing's off the table going forward.
Okay.
For us, I would say there are some states that require it, by the way. We have above cafe personnel in 48 states, and there are states that, like California, that require the stipend. So we've had to adapt some of the policies. And also power outages in California is an interesting problem to solve. Solvable though, with some creativity and moxie. The other one, which has been an interesting transformation for us, a lot of us like to go visit cafes. Now we're trying not to, right? Because you're trying to keep that cafe as clean and safe as possible. And so they don't want to see us either, right? As executives or IT people, so trying to diagnose a little bit more remote, doing things a little bit more remote. It's been certainly a different challenge.
Okay. All right, let's see here. Oh, here, I love this one. Any skill sets that you forgot and then found again by going through the past 10 months? Or talent you needed to bring into survive, things like sleep deprivation, relationship building, recruiting, adaptability. You know, what did you resurface, maybe skills that you had before that you had put dormant that now you picked up again?
That's a good Tim Cross question, Tim. It's a very, very good one.
So for me, I think what's interesting in video one-on-ones and those type of things with employees, I go back to when I had people in Europe. You always started the conversation with something personal, right? Just spend a couple minutes on a personal level, checking in with people. How are you? How is the family doing? For Tim Cross, you'd ask how Alex is doing. Who's also on here, I see. So doing that little bit of a personal touch though, and making sure that you have that connection still, right? You're remote, so it takes a little bit of extra effort to make that connection.
Okay, let's see here. Do you envision opportunities for IT to lead the way because of the critical role of IT in providing the infrastructure for remote work?
I'd say, I'm sorry, we can both comment. I'd say, I think that was kind of an entry ticket into this thing. I think, coming through on the infrastructure was kind of the table stakes that we had to provide as leaders for our organization, but I don't think we can ride that very long. I think the organization is going to require digital innovation out of us. And so I think it's more than that. We have to keep that stuff going and reliable and very cost effective. But, I think for us to stay at the table, we have to be bringing ideas that really change the game and really change our customer experience.
Totally agree. I think, again, to me, technology, the value there is how are you assisting the organization to grow and innovate? That's what keeps you at the table.
Okay. Many companies are commenting that the pandemic, like you guys have said, has accelerated your digital transformation. Maybe that you've even moved some of your 2023 or 2022 goals from that roadmap into accelerating them into the current day. Could you kind of talk anything more about, maybe one or two examples of what technologies you weren't even thinking about that maybe you brought into the current age?
So I can do a little bit of this, I guess. I'll build a little bit on the point Jerry made. You talk about needing to stay with the innovation, to stay at the table. I think it's basic of focusing on the business problem to stay at the table, right? So, gone are the days where the IT person shows up and says, "Now, what are your requirements and what do you want me to do?" No. What's the business problem? How do we all solve it, right? As one team. that in turn will lead you to some of these newer technologies that you need to stay abreast of. Maybe it's geolocations. It's beyond, for us, geofencing became important. We're looking at things that are much more micro and has a higher level of precision for that. So we can tell where that customer is on the property itself, not just the fact that they've gotten near the property or driven by the property. We also look at a lot of AI now and predictions of things, right? So how do we predict a customer or an employee doing X, which we really don't want them to do, and move them to Y? Showing up without a mask, something along those lines, right? How do you react very quickly to what you can detect?
Okay.
Yeah, I would say for the last 30 years, we have relied on applications to provide the user experience. As we go forward, data will provide a much richer experience from a user point of view. And so that to me is coming back to the table in terms of how do I provide an experience that's personalized to me and customized to me, I think is significant.
Yeah, I totally agree with that one. That idea that whoever that provider is, knows enough about me to be informative, to lead me to my preferences, but not so much about me that it's intrusive. I think that's going to be an interesting balance.
And it's, it can be as easy as, well, how do I, as a consumer of healthcare, which we all are, want to be engaged?
Right.
Yeah.
All right.
No, I was going to add, I think it's, I'm going to add, Jeff, I think it's important, obviously we're all focused on meeting the needs of the consumer, but I do think those of us in IT leadership also have opportunities to bring some automation capabilities to the internal operations of our organization. So, Jerry and I both know that there's lots of friction and lots of caregiver stress that we could maybe alleviate with technology automation. So at the same time, we're looking at our external ways to really make the customer experience better. I think if we could also be evangelists of process automation and things like robotic process automation to take task out of the workday of our caregivers and of our internal coworkers. That'll make us a more higher fulfilling organization too. So I think that's, I think we all have those opportunities. So just as much as we have with the consumer, we also have the ability to make our operation work better and more efficiently, and therefore have higher capacity.
Guys, we have about 20 minutes left. Let's say 15, because I know we don't want to run over. So let's do this. There's some questions out here that I would like to get to, but let's focus to start on what are the things that you've seen so far. Maybe one or two things from each of you. What have you seen so far that will absolutely persist? What have you seen that maybe won't? And what else do you think needs to happen? Maybe if we could hit on those. Anybody want to go first? Go ahead, jump in.
I think one of the biggest obvious ones is the persistence of people working remote. The days of everyone being in the office on the same day are gone. One of the participants here, JC Rudden, was instrumental in us getting ahead of that years ago when we had weather problems, making sure that people could work from remote ahead of time. That saved us through this process. That's not going to go away. So how do you still embrace all this video and remote work?
Okay.
Yeah, I feel like a broken record. I think the experiences that you provide consumers of your technology will continue to accelerate, and managing those transitions will be huge in terms of differentiating yourself going forward.
Scott, how about you?
Yeah, so I think some of the same themes, that I'll touch on that permanent remote workforce, and one thing there's some implications of that. I think that changes how we hire. So our workforce now, if we do have remote workforce, and Jerry's already experiencing this, but now we have a nationwide and maybe even international recruiting pool to draw from where we wouldn't have thought of that before. But we also have recruiting competition from all over the country now. So I know that our team, we've lost some people to NFL cities that that hired some of our people away, and they didn't have to move out of St. Louis. And so that's something I think we have to be aware of and come to grips with. And at the same time, you know, we all have our organizational culture, and that's very important to us at Mercy. And I think you know, even this remote work, how do we develop that, keep that strong, figure out what our version of it is in a remote workforce model. You know, how do we adapt our onboarding and our team dynamics and our leadership styles? And so I think that's here to stay. But I think our evolution in that area is not very far along yet. We've got a long ways to go there. I do think I'll also mention, as Jerry mentioned, our digital care models are here to stay. So as you mentioned, you know, people don't want to come in for certain things and they want to be touchless, and that's definitely permanent. And I think the idea of this decision making, the way we decide things now, and the way we have this kind of more centralized, more focused command center approach, I don't see that going away for our organization for quite a while, because that's been gotten a lot of traction, and it's really got us focused. And so ultimately that means from an IT provider perspective, we have to keep being bimodal and meet those needs of those day-to-day operational adjustments and those quick iterations, but also keep the long-term things going, keep the trains on time, but make sure our 4 and 5 year strategies and infrastructure and our app portfolio, you know, lined up, and we're making long-term strides as well.
John, did you want to add anything to that?
I think Scott touched on a few of the key problems, right? How do you hire and onboard remote and train? That's become a particular challenge. You have to rethink your training a bit. And then how do you assimilate the culture? And that's very difficult.
Yeah, I totally agree. I've hired myself a dozen project managers since July 1st, and not a single one of them have been to an office yet. They've all received all of their hardware and software remote. They've put up their dual monitors and gotten connected through Teams and Zoom, and I haven't physically shaken their hand yet. So that's really interesting, and that challenges me all the time, is to think about how do I help them recognize the culture and assimilate, you know, both their strengths and the culture's strengths. It's almost a little bit antiseptic as to how you do that, because
one of the things I found is that shared experiences build the culture, right?
Yep.
So how do you build shared experiences in a video world?
Yep.
And that takes creativity.
You know, John, I'm glad you mentioned that, because when I'm talking to a lot of people at the office, that they're saying, you know, I'm having trouble with this remote workforce. I'm not seeing people. I'm not interacting with folks. And I certainly feel that. But then I ask them the question, well, are you using your video? And I'm hearing from a lot of people that aren't turning their video on. And I know, I mean, that blows me away.
We have many meetings. Most people decide to make video mandatory. We have many meetings where we make the audio and video mandatory, so no going on mute. I'm a little bit more of the, I like to mute it, because who knows what sound is going on in the background of my house with a couple college kids at home.
Right.
But we have had those forced upon us from time to time.
Yeah, I mean, we mandate audio and video, because I mean, again, it's you know, part of it is just making sure that you're engaging everyone effectively and leveraging a new medium to do that, since you don't have the water cooler talk anymore. So
and I'm not even thinking of that. Like, I'm thinking about it in terms of the workspace, but us as individuals we can model that as leaders. You know, there's calls I get on at work at RGA sometimes, and people are like, oh, Vilmer's got his video on again. Let's all turn our video on. But I think, you know, we have an opportunity to actually influence a wider culture of human beings with engagement. And if we don't do that, man, we're missing a leadership opportunity.
You know, it's interesting talking about culture, and I'm so there as well to make sure you've got the right culture. for us, I mean, it's assumed that when we have these meetings, everyone's on video. And if you're not on video, I mean, okay, so why aren't you on video? And, oh, I have this problem. I mean, so you get hazed for it. So I think, part of that is just, the expectations is that you're all going to engage. And typically, I mean, I would say that 95% of the meetings I'm in, probably higher than that, I mean, everyone's video's on.
Yeah. Interesting. Okay.
I'm curious of how have you all found employee celebrations, or we've had retirement parties over WebEx, and sometimes my boss one time sent out a bunch of Grubhub gift certificates and says we're going to have a lunch meeting. It's a little awkward to eat right in front of your camera. It feels a little strange, but I'm just curious. Besides the meetings, how are you utilizing this collaboration technology to make life feel more normal for celebrations and going away parties and that kind of thing?
Funny you should mention that. Panera is launching something soon where we can actually have a catered meeting and everyone gets a voucher and gets to order Panera delivery to their house for the discussion. So
Nice.
I'm so happy that you brought that question up. Wasn't even planning
I'll
ahead
keep
of time,
that in
I
mind.
swear.
Okay.
Yeah, we're actually talking about things like that for even our holiday gatherings now. Can you drop ship gingerbread house making kit to somebody's house, and then we all get on together and have a competition? But things like that, I think you have to be deliberate and you have to be creative in how you apply it. And that's one of the things that I'm always concerned about with people being so pressed. From we talked about this the other day. You go from meeting to meeting to meeting by clicking. I don't even get up out of my chair and walk around the table before I'm joining another meeting. And so that intentionality of making sure that people are engaged, and I know you guys are doing it. It's just something I think that's important to share with everybody here. There's one last question I want to get to. I think we may have covered some of it, but let's try this. How has this year's experience changed the way you're going to approach your IT roadmap in the future? Do you have a 2 to 3 year strategy? Are you guys looking at a 3 to 5 year strategy? Is it 2 to 3 month strategy? What's that look like for you?
So we've actually coined a term. We're stolen it from a different restaurant company, but it's called Future Back. We picture what we want it to look like in 2 years, and then we work our way back.
Okay.
So pick the time in the future and work your way backwards. And we've had to redo that now, given new circumstances and how fast we've moved and how fast the consumers moved.
Okay. Anybody else?
Yeah, we have actually we're re-swizzling our 3-year plan. And there are clearly some of those no regret moves, right? So, but we're given the change in our industry and the continued change, we've actually working with our larger group in terms of how does technology inform and enable the larger strategy. And obviously there's quite a bit of work on that. We've talked about quite a bit of it today in terms of just the digital strategy to enable the front door to the back door, if you will, in terms of the entire care continuum, and how do we start to leverage that more effectively and provide the experiences for our customers and for our caregivers that make them more effective and engaged along the care journey.
Scott, anything you want to add?
Yeah. I think kind of as Jerry kind of kicked us off, I think the main theme is that the digital transformation goals are not fluff. They're real. We've proven things with them during this crisis, and so I think we're all the more determined to accelerate that. And I think so that definitely means the design thinking approach. We have to change the way it's got to be, consumers, start with the consumer and build out from there. And that drives, other things, including, building our data and our data assets into real-time actionable insights that feed that consumer experience. And, healthcare hasn't been that great at that yet. We've relied on our EMR for all of our data. And I think we have to start blending that with consumer insights and social determinant types of insights. And so I think that'll drive that'll enable our consumer digital experience. And then, like I said before, I also think we've learned that automation and taking tasks out of the caregiver's work to make sure all of our, in healthcare, we say we want our caregivers to operate at the top of their license all the time. So if nurses and physicians are performing menial tasks that aren't necessary, how can we take that away with automation and with process improvement? So I think those things are all just more acute than they ever have been before. And I think it's set our resolve to put more investment into those things and to put more urgency on them.
Okay. Folks, I want to offer a couple things here. I think it's critically important that we recognize that this happened the other day during our prep sessions, and it happened again today. I almost never heard these three gentlemen talk about network capacity. Only when prompted did John talk about devices. I mean, I forced him into some of those demographics, but what comes across to me is that IT, technology leadership, has got to be about what's going on with the business. You got to understand the business strategy. When these guys were going through this stuff, every single time they're talking about, we got to cut down on the wait time on this guy. We've got to produce apps that deliver customer care value. And it's not produce apps, it's we got to deliver customer care value. And how do we do that? And John's talking about the operation of the store. So I think as technology leaders, that's something you cannot minimize. The importance of being a solution provider and walking into the room, and instead of saying, tell me your requirements, it's what pain points are we trying to solve? And maybe even observing those yourself when you bring it in. So those are just some of the things. Now, all that other stuff, John doesn't get relief from availability. But all those things are table stakes, right? You got to pay those things to play. So, button up your basics, do the needful there, and then, man, be thinking as a businessman, a business person. Sorry. So, with that being said, guys, I genuinely appreciate you taking the time out of your busy day to join with us. I know this is probably some of your time when you're closing up shop or you're maybe settling in for dinner with the family. So I'm grateful to have been able to spend the time with you. By the way, the G2I, the Gateway to Innovation, and the SIM Give Back, over $2 million is what the sum's up to now. So thank you, SIM, and I'm going to hand it back to Becky.
Oh, Jeff, thank you so much for facilitating tonight. And thank you, Scott and John and Jerry, for your great insights and information and knowledge. I know I took a lot away from this. And for those that want to replay it, we've recorded this, and my intent is to, by close of business tomorrow, have this posted on our Sim St. Louis YouTube page and our Sim St. Louis webpage if you want to go back and review it and think about it some more. So thank you so much, gentlemen. At this point in time, if we were all physically together, everybody would applaud. So I'm just gonna applaud and thank you so much for your time. I know the last thing you probably want to do on a Wednesday is spend your evening on Zoom. So thank you for your time. Thank you for your wisdom. May your businesses prosper, your systems stay up, your technology work, and you have a thank you all.
All right, everybody.
Amen to that.
Thank you guys for all you participants. Thanks for joining too. Everybody have a good night.